What happens to your body when you stimulate the male G-spot? The hidden truth about prostate massage. Have you ever stopped to consider what's quietly happening to your body as you age, especially below the belt? Here's a startling fact. Studies show that nearly 80% of men over the age of 80 experience some level of benign prostatic hyperplasia, BPH, also known as prostate enlargement. But what most people don't realize is this condition doesn't just affect the elderly. Symptoms often begin creeping in as early as your 40s or 50s, leading to frequent urination, weak flow, sexual dysfunction, and even chronic pelvic discomfort. What's even more alarming, millions of men silently endure these symptoms, too embarrassed to talk about them or too skeptical to explore natural, non-invasive solutions. One of those overlooked solutions, prostate massage, could be a game changer. Also known as the stimulation of the male G-spot, this practice is still cloaked in shame, myths, and stigma. But here's the truth. Prostate massage isn't just about pleasure. It's about health, healing, and rediscovering control over your body. Medical experts like Dr. Charles Pollack, a urologist with over 30 years of experience, say that gentle, regular prostate stimulation may help improve circulation in the gland, relieve congestive symptoms, and potentially reduce inflammation. In fact, in some cases, it's even been linked to improvements in erectile quality and ejaculatory function. Meanwhile, in real life, thousands of men around the world, yes, ordinary men, are turning to prostate massage as a preventive tool or a last resort after years of failed medications and awkward doctor visits. One 52-year-old man from Ohio reported in an anonymous survey that after incorporating prostate massage twice a week, I finally slept through the night without waking up to pee 5 times. I wish I had known about this 10 years ago. And yet, this technique remains one of the most misunderstood and underutilized practices in men's health. It's time to change that. So before we dive deep into the shocking truths about prostate massage, do us and your body a favor. Like this video if you care about your long-term health. Share it with a friend who needs to know. Subscribe to our channel for more real, science-backed health content every week. And in the comments below, we want to hear from you. Have you ever tried prostate massage? Are you curious about its effects or still unsure? Let's break the taboo together and help more men reclaim their sexual confidence and health naturally. What and where is the prostate? Before we dive into techniques, risks, and life-changing benefits, we need to build a solid foundation, starting with the anatomy. So let's begin with the simple but often overlooked question: what exactly is the prostate and where is it located? The prostate gland is a small muscular organ roughly the size and shape of a walnut, typically measuring about 1.5 inches in diameter. It sits deep within the male pelvic cavity, positioned just below the bladder and directly in front of the rectum. Importantly, it wraps around the urethra, the narrow tube that carries urine from the bladder and semen from the reproductive tract out through the penis. But don't be fooled by its size. This tiny gland plays a massive role in male health. Its primary biological function is to produce seminal fluid, a thick, milky secretion that combines with sperm cells and other fluids to form semen. This fluid not only nourishes and protects sperm, but also improves motility, helping sperm reach their target during intercourse. Without the prostate's contribution, reproduction would be virtually impossible. However, there's a lesser-known side to the prostate that rarely gets talked about, especially outside of urology clinics or behind closed bedroom doors. The prostate is densely packed with nerve endings and highly sensitive to touch and pressure. According to Dr. Andrew Siegel, a board-certified urologist and author of Male Pelvic Fitness, the prostate is an incredibly responsive organ, biologically and neurologically. This makes it a major pleasure zone, often described by those who've experienced it as the male G-spot or P-spot. Now here's where things get even more interesting. The prostate's dual role, both as a reproductive organ and as a nerve-rich pleasure center, makes it unique in the male body. Yet most men are completely unaware of how to maintain or utilize this organ until something goes wrong. Prostate issues such as prostatitis, the inflammation, BPH, benign enlargement, or even early-stage prostate cancer often begin with silent symptoms like increased urination, weak urine stream, pain, or discomfort during ejaculation. And by the time symptoms are noticeable, the condition has often progressed significantly. But here's the twist. While prostate stimulation is often seen purely through the lens of sexual exploration, it may also provide therapeutic benefits. Studies from journals like Urology and the Journal of Andrology suggest that gentle, regular prostate massage could help improve blood flow, reduce inflammation, and alleviate the symptoms of chronic prostatitis or pelvic tension syndrome. In fact, before antibiotics became widespread, manual prostate massage was a standard medical treatment for prostate-related disorders. Real-life examples are increasingly common. A 48-year-old man in New York who had been suffering from chronic pelvic pain for over a year tried everything, from antibiotics to physical therapy, with little success. Upon his urologist's suggestion, he incorporated gentle prostate massage into his routine. After a few weeks, the pressure in my pelvis eased up, he says. It wasn't just a sexual thing, it was relief. And yet, despite mounting evidence, social discomfort and misinformation still dominate the conversation. Many men are never even told about the prostate's full function or its potential for pleasure and healing. Cultural taboos, fear of judgment, and a lack of accurate education keep this essential organ shrouded in mystery. So if you've never thought much about your prostate until now, don't worry, you're not alone. But by understanding where it is, what it does, and how it affects both your health and your sexual well-being, you're already ahead of the curve. Stay tuned, because in the next section, we're going to uncover the true nature of prostate massage, what it is, how it's done, and why it might be one of the most underrated tools in modern male wellness. What exactly is prostate massage? Now that we understand the anatomy and importance of the prostate, let's talk about something that's often whispered about, if mentioned at all. Prostate massage. What is it exactly? Is it medical? Is it sexual? Or is it somewhere in between? Let's clear the confusion. Prostate massage refers to the intentional stimulation of the prostate gland, most commonly through the rectum, using fingers or specialized tools. Since the prostate is located just a couple of inches inside the anal canal, toward the front of the body, it can be accessed relatively easily with the right technique, knowledge, and hygiene. This practice can be performed by a medical professional for diagnostic or therapeutic purposes, or by individuals and their partners for enhanced sexual pleasure or health maintenance. Two distinct forms of prostate massage. One, medical prostate massage. While it may sound new to some, prostate massage has actually been part of traditional urological care for over a century. In fact, before antibiotics became standard treatment, doctors routinely performed manual prostate drainage to relieve inflammation and infection. Purpose. Historically, this technique was used to extract prostatic fluid for laboratory testing or to help alleviate the symptoms of chronic prostatitis, a painful, often recurring condition that affects millions of men worldwide. Modern uses. Today, some urologists still use it as a supplementary approach, particularly when antibiotics fail to fully address inflammation. According to Dr. Jason Kovac, a male reproductive specialist, in select cases, especially with chronic non-bacterial prostatitis, prostate massage may reduce pressure buildup and improve antibiotic penetration into the gland. Interestingly, in some parts of Asia and Eastern Europe, medical prostate massage is still a routine treatment, especially when men report pelvic pain, urinary discomfort, or post-ejaculatory pain. 2. Erotic prostate massage. This form of stimulation is focused on enhancing sexual experience, and it's what has earned the prostate its nickname, the male G-spot. Techniques. Erotic prostate stimulation typically involves the use of fingers or curved devices designed specifically for internal massage. These tools often have ergonomic shapes to apply pressure directly to the front wall of the rectum, where the prostate sits. Reported benefits. Many men who engage in this practice report stronger, more intense orgasms, sometimes described as full-body or hands-free climaxes. Some even note increased semen volume, greater control over ejaculation, and prolonged pleasure. Audience, contrary to popular belief, This practice is not limited to any one sexual orientation. Surveys reveal that heterosexual men are increasingly open to exploring prostate stimulation, especially as attitudes toward masculinity, pleasure, and self-care evolve. The prostate is an untapped source of pleasure for many men, says Dr. Ian Kerner, a certified sex therapist and author of She Comes First. When explored mindfully and safely, it can create a whole new dimension of intimacy and self-awareness. A brief history of controversy. Despite its long-standing history in both medicine and sexuality, prostate massage remains controversial, particularly in the West. The reasons are complex. Cultural discomfort with anal stimulation often reinforces the idea that this practice is off-limits or emasculating. Medical skepticism lingers due to inconsistent clinical studies, even though thousands of anecdotal accounts and some emerging research point toward real benefits. Lack of education. Most men never even learn about their prostate in sex ed, let alone how to care for it. This cultural silence leads many men to suffer in isolation, turning to forums and anonymous websites to ask questions they're too afraid to raise with their doctors. Real-world testimony. Let's not forget the human side. In a 2023 Reddit AMA, Ask Me Anything, on men's health, one user shared his story. I was skeptical and kind of embarrassed, but after months of prostatitis and being tired of antibiotics, I gave it a try. I followed safety tips, went slow, and used a massager. Within 2 weeks, the pelvic pain started easing up. Plus, the orgasms were next level. And he's not alone. There are entire communities on Reddit, health forums, even Facebook groups where men share experiences, advice, and encouragement. Some explore it as part of a healing journey, others as a discovery of self-pleasure without shame. In the next section, we're going to break it all down with science. What research actually says about the benefits and risks of prostate stimulation, and whether this misunderstood practice deserves a second look in modern health conversations. So stay tuned, because the truth might just surprise you. The science behind prostate stimulation. What does research say? Extended version. Let's take a step back from anecdotal stories and pleasure-driven testimonials to focus on the hard science behind prostate stimulation. While millions of men claim to have experienced physical and sexual benefits from prostate massage, what does actual clinical research have to say? Can modern medicine validate what many already believe to be true? The short answer is yes, but with caveats. The long answer requires us to unpack the complex interplay between science, sexuality, and stigma, and how that has shaped the limited, but promising, body of research available today. Prostate massage and BPH, a case study worth noting. Let's begin with one of the most eye-catching findings to date. In a 2023 case study published in the Journal of Integrative Men's Health, a 67-year-old man suffering from benign prostatic hyperplasia, BPH, a common condition involving prostate enlargement, underwent a consistent prostate massage routine twice a week for 8 weeks. By the end of the treatment period, his prostate volume had shrunk by approximately 30%, and he reported marked improvement in urinary flow, sexual performance, and pelvic comfort. While this was a single-subject study and therefore not generalizable, it raises an important question. Could a simple, non-invasive intervention like prostate massage offer a low-risk way to manage early BPH? The researchers called for larger, randomized trials, but cautiously suggested that this technique could be a complementary option, especially for men seeking alternatives to pharmaceuticals or surgery. Prostate massage plus antibiotics equals relief for chronic prostatitis? One of the more substantial reviews on this topic comes from a 2018 clinical meta-analysis that examined the role of prostate massage in managing chronic prostatitis, chronic pelvic pain syndrome, CP-CPPS, a notoriously difficult condition that affects millions of men and is often resistant to traditional treatments. Researchers found that when prostate massage was combined with antibiotics, patients experienced greater symptom relief compared to antibiotics alone. The proposed explanation? Prostate massage may improve drug penetration, drain excess prostatic fluid, and stimulate circulation, making the internal environment less hospitable to bacteria and inflammation. This reinforces the idea that prostate massage isn't merely a sexual novelty. It could be a serious medical tool for conditions previously considered untreatable by many clinicians. Insights from the East. The Japanese Urinary Flow Study. In 2015, a Japanese research team studied the effects of routine prostate massage on urinary flow rate and bladder control in a group of men aged 60 to 75. These participants, all experiencing mild to moderate urinary symptoms, engaged in bi-weekly prostate stimulation sessions for 3 months. The results? A statistically significant improvement in urinary flow rate, more volume per second, bladder emptying efficiency, and a reduction in nighttime urination frequency, a major quality of life issue for older men. What makes this study particularly valuable is that it came from a non-Western clinical setting, where cultural taboos about prostate health are often less rigid. Eastern medicine has long viewed the pelvic region as a critical energy and detox center, and practices like perineal acupressure or internal massage are more normalized. The limitations. Why more research is needed? Despite these intriguing findings, the medical establishment remains cautious. Why? 1. Sample sizes are small. Most studies involve fewer than 100 participants, which limits the strength of statistical conclusions. 2. Methodological variations. There's no universal protocol for prostate massage. Some use fingers, others use devices. Some emphasize medical outcomes, others focus on pleasure. 3. Cultural and ethical sensitivities. Research funding for anything involving male anal stimulation is still controversial in some countries, leading to a shortage of large-scale, peer-reviewed studies. 4th, placebo and psychological effects. Some benefits could be influenced by increased sexual confidence, relaxation, or better pelvic floor awareness, rather than direct physiological changes. Still, these limitations do not negate the potential. According to Dr. Charles Meyer, a urologist at Johns Hopkins, the prostate remains one of the most under-researched organs in male health. What we're seeing now is a slow but growing curiosity about non-traditional methods like massage, not as replacements for medicine, but as complements. Real-world experience and expert commentary. Beyond formal studies, real-life reports are impossible to ignore. Online health communities such as Reddit's RR Prostatitis and various men's health subforums are filled with testimonies from men who've tried everything until discovering prostate massage. One user writes, "My doctor gave up on me after 3 rounds of antibiotics. I started doing self-massage weekly, following a urologist's YouTube tutorial. Within weeks, I was urinating normally again. I'm honestly shocked no one talks about this." Sex therapists and men's health coaches are also beginning to normalize these conversations. Dr. Michael Aaron, a clinical sexologist, explains, "Men are taught to ignore or fear their prostate, but from a clinical standpoint, it's a part of the body that responds to touch, pressure, and attention like any other organ. It's time to demystify it." Bottom line. So what does the science say? While we're still in the early phases of understanding prostate stimulation's full potential, early findings are encouraging. Whether for managing chronic conditions like prostatitis and BPH, or exploring new dimensions of sexual health, prostate massage deserves serious attention from the medical community and from men themselves. Coming up next, we'll explore what this actually means for you. What are the real-life benefits of prostate massage, and what kind of changes can you expect if you begin this practice regularly? Stay with us. It only gets more revealing from here. Real benefits of prostate massage. What can it do for you? Extended version. Now that we've explored the anatomy and the emerging science behind prostate stimulation, let's turn our attention to a question that many men are quietly asking, but few dare to discuss openly. What real, tangible benefits can prostate massage offer, not just in theory, but in everyday life? From transforming your sexual experience to relieving stubborn urinary issues, prostate massage has been linked to a range of physical, psychological, and even emotional improvements. Some are backed by science, others by consistent real-world reports. Let's break them down one by one. 1. Enhanced orgasms. the full-body ecstasy phenomenon. One of the most widely reported benefits is the intensification of orgasms. Unlike typical penile stimulation, which activates mostly the nerve endings around the glands and shaft, prostate stimulation taps into a dense network of internal pelvic nerves, particularly the pelvic splanchnic nerves. When stimulated, these nerves can produce what many describe as a hands-free full-body orgasm, a wave-like release that starts deep in the core and radiates through the limbs, spine, and even the face. For some men, it feels more emotionally satisfying and longer-lasting than traditional ejaculation. "It felt like I was surfing on a ripple of electricity for over a minute," says Ben, 42, a teacher from Oregon, who began exploring prostate massage during the pandemic. "There was no direct penile touch, but I came harder than I ever have." Sexologists refer to this phenomenon as a prostate-induced orgasm, PIO, and believe it may trigger activity in the parasympathetic nervous system, which promotes relaxation, emotional bonding, and heightened pleasure. This is why many refer to the prostate as the male G-spot, because when properly stimulated, it can unlock a new spectrum of orgasmic pleasure that most men never realize is possible. 2. Improved urination, relief from hesitancy and weak flow. Men over 40 often experience changes in their urinary habits, more frequent urges, weaker streams, or the dreaded start-stop flow. These symptoms are frequently linked to benign prostatic hyperplasia, BPH, where an enlarged prostate compresses the urethra and obstructs urine flow. Prostate massage, by gently manipulating the tissue, can help reduce internal swelling, release built-up fluid, and relieve pressure on the urethra. In some cases, men report immediate improvement in flow and reduced need to urinate during the night, nocturia. A small Korean study published in Urology International found that men who underwent weekly prostate massage for 2 months showed a statistically significant increase in peak urinary flow rate. "It felt like unclogging a drain," says Alan, 58, a retired firefighter from Chicago. "I used to get up 4 times a night to pee. After starting prostate massage, I'm down to once, and sometimes I sleep straight through." While more research is needed, this growing body of anecdotal evidence suggests prostate massage may be a non-pharmaceutical option for men dealing with mild to moderate urinary issues. 3. Relief from chronic prostatitis when nothing else works. Chronic prostatitis, or chronic pelvic pain syndrome, CPPS, is often described by urologists as one of the most frustrating conditions to treat. Men report symptoms like burning urination, aching perineal pain, and pelvic tension that persists for months or even years, with no clear bacterial infection to blame. This is where prostate massage may play a vital role. By promoting fluid drainage, stimulating local blood flow, and reducing congestion, prostate massage can help relieve pressure and inflammation, especially when used alongside anti-inflammatories or antibiotics. A 2018 study in the Prostate Journal found that men with non-bacterial prostatitis who received regular prostate massage reported a 40% reduction in pain scores, improved mood, and even better sexual performance. "I tried everything, painkillers, physical therapy, you name it," says Jamal, 36, a software engineer. "But prostate massage was the first thing that gave me lasting relief. It's like someone turned off the alarm inside my body." Although Western medicine still debates its effectiveness, many holistic urologists and functional medicine practitioners are now incorporating manual therapy techniques, including internal massage, into their treatment protocols for prostatitis. 4. Improved sexual function. Beyond just pleasure. Besides pleasure and pain relief, prostate massage is also linked to better sexual function overall. Some reported improvements include stronger, longer-lasting erections, possibly due to better pelvic blood circulation and less internal tension. Increased semen volume. The prostate is responsible for up to 30% of seminal fluid, so regular stimulation may improve secretion. More controlled ejaculation. Some men find they last longer or can delay climax more easily when their pelvic floor and prostate are in balance. According to Dr. Raymond Chong, a urologist and men's sexual health specialist, the pelvic region works as a unit, If one part is tight, inflamed, or underused, it affects everything, from erection strength to orgasm quality. Prostate massage seems to enhance coordination between the muscles, glands, and nerves involved in sexual activity. 5. Detox and circulatory benefits. The controversial claim. Some advocates believe prostate massage offers a detox effect, helping flush toxins, reduce oxidative stress, and even improve lymphatic circulation in the pelvic basin. However, this claim is more speculative and lacks strong scientific backing. Still, there's a logical theory. Because the prostate can accumulate stagnant fluid and minor blockages over time, massaging it may help clear the pipes, much like expressing a clogged gland or lymph node. Some practitioners liken this to lymphatic drainage massage, which is widely accepted for reducing inflammation elsewhere in the body. While mainstream medicine hasn't officially embraced the detox angle, users consistently report feeling lighter, more balanced, or more energized after sessions, suggesting there may be more at play than just placebo. Psychological and emotional benefits. The hidden bonus. Finally, don't underestimate the mental and emotional perks of prostate massage. For many men, especially those struggling with shame, tension, or trauma around sexuality, learning to explore the prostate in a respectful, mindful way can lead to greater body awareness, deeper sexual confidence, reduced performance anxiety, improved relationship intimacy. Some couples even use prostate play as part of sensate focus therapy, a technique used by sex therapists to rebuild sexual trust and excitement. Final thoughts on benefits. To sum it up, prostate massage may offer a multifaceted health boost, one that transcends simple pleasure. From relieving pain and enhancing orgasms to improving urinary flow and sexual confidence, it's a practice worthy of open-minded exploration. Risks and red flags. When prostate massage can be dangerous. Just because something can be beneficial doesn't mean it's risk-free. Let's talk about the dangers you must take seriously before ever attempting prostate massage. As prostate massage grows in popularity, both for medical and sensual reasons, so does the urgency to talk about the potential dangers involved. Despite the many reported benefits, this is still a practice that involves internal stimulation of a delicate organ, and when done without proper preparation, hygiene, or understanding, the consequences can be very real, and in some cases, medically serious. Think of it like driving a high-performance car. Sure, it can be thrilling, but without the proper training, maintenance, and safety measures, it could easily result in a wreck. In the same way, prostate massage must be approached with respect, knowledge, and caution. Let's take a closer look at the real risks, how they happen, and what red flags to never ignore. 1. Infection, the silent risk that can escalate quickly. One of the most common and dangerous risks of prostate massage is infection, particularly urinary tract infections, UTIs, and bacterial prostatitis. The anus and rectum are full of bacteria, even if you feel clean. Introducing any foreign object, or even your own fingers, into the rectum without proper sanitation can easily push E. coli and other pathogens into the prostate or urinary tract. Once bacteria enter the prostatic ducts, they can trigger painful inflammation, high fever, and in extreme cases, even blood poisoning, sepsis. Dr. Nathaniel Lopez, a board-certified urologist, warns, prostate massage should never be performed casually. Even minor lapses in hygiene can introduce bacteria into the urinary tract. This is particularly dangerous for men with weakened immune systems or underlying conditions. Real-world case reports show that men with recent rectal procedures, hemorrhoids, or even small cuts around the anus are far more vulnerable to these infections. The danger increases dramatically if you use toys that are porous, shared, or improperly cleaned. Red flag signs of infection: burning during urination, fever or chills, cloudy or foul-smelling urine, pain in the lower back or perineum. If you experience any of these within 24 to 72 hours of prostate stimulation, seek medical help immediately. 2. Tissue damage, when curiosity turns into a medical emergency. The rectal wall and prostate are delicate structures. Aggressive or careless stimulation, especially by beginners, can lead to tears, bleeding, or trauma to both the internal and surrounding tissues. Let's break this down. The rectum is lined with soft, sensitive mucosa, not muscle or skin. Forceful insertion, use of the wrong type of tool, or ignoring discomfort can lacerate the lining, leading to internal bleeding or even a perforation. "I thought I was being gentle," admits Robert, 37, who had to visit the ER after attempting self-massage with a plastic toy not designed for internal use. "But I ended up with a rectal tear and couldn't sit properly for 2 weeks." Additionally, hemorrhoids, which many men suffer from without knowing, can become inflamed or rupture during internal pressure. This not only causes intense pain, but can lead to chronic rectal issues if not treated properly. Warning signs of tissue damage: sharp or stabbing pain during insertion, bright red bleeding from the anus, difficulty sitting or walking, sudden swelling or bulging near the anus. If you encounter any of these, stop immediately and consult a doctor. It's always better to be safe than to risk long-term rectal damage. Third, worsening of existing medical conditions. There are certain medical conditions where prostate massage should be completely avoided unless under direct guidance from a healthcare professional. These include acute prostatitis. If your prostate is already inflamed due to infection, massaging it can push bacteria deeper into the tissue, increasing the risk of abscess formation or bloodstream infection. This is one of the most dangerous mistakes and can rapidly escalate into a hospital-level emergency. Prostate cancer. Men diagnosed with prostate cancer, or those being monitored for elevated PSA levels, should not attempt prostate massage without medical clearance. There is concern that stimulating a cancerous prostate could dislodge cancer cells, although this risk is still being studied. Rectal conditions, fissures, Crohn's disease, ulcers. If you have inflammatory bowel diseases or known issues with the rectal lining, prostate massage may irritate or worsen symptoms. Some men with Crohn's have reported flare-ups after internal stimulation. Dr. Lisa Wang, a colorectal surgeon, emphasizes, internal stimulation of any kind should be avoided in patients with fragile rectal tissues or chronic inflammation. Even a small disturbance can trigger bleeding or ulceration. 4. Psychological discomfort and shame. While not physical, we must also talk about emotional and psychological risk, especially for men new to prostate exploration. Feelings of shame, anxiety, or confusion can arise during or after a session, particularly in cultures where male anal stimulation is stigmatized. Some men report feeling violated or dirty after trying prostate play for the first time, especially if they rushed into it without education or preparation. This can lead to long-term shame around sexuality, reduced libido, or avoidance of intimacy. That's why emotional readiness and a healthy, informed mindset are crucial. Watching educational content, reading trusted guides, and if needed, talking to a sex therapist can help you process these emotions in a mature, positive way. So, how do you know if it's safe for you? If you're asking yourself, is prostate massage safe for me? The honest answer depends on your medical history, current symptoms, hygiene habits, and emotional readiness. Here's a quick self-check. Do you have any diagnosed prostate or rectal condition? Have you recently had unexplained pelvic or urinary symptoms? Are you using clean, body-safe tools with proper lubrication? Are you relaxed, informed, and emotionally grounded before starting? If the answer to any of those is no, then stop. Speak to a doctor before continuing. This isn't something you want to wing. Final word on risks. Prostate massage can be life-changing, but only if done safely and responsibly. It's not a party trick or a shortcut to better sex. It's a deeply personal practice that interacts with one of the most sensitive areas of your body. So treat it that way. Be cautious, be informed, and above all, listen to your body. Pain, resistance, or hesitation are not enemies. They are your body's way of guiding you toward safety. How to safely explore prostate massage. If you're curious about prostate massage but worried about doing it wrong, this part is for you. Let's walk through the right way to explore it safely, cleanly, and respectfully. Now that we've talked about the risks, It's time to switch gears and explore how to do it right. For many men, prostate massage can be a powerful tool. Whether you're aiming for better orgasms, improved urinary health, or simply greater body awareness. But like learning to drive a car or cook a gourmet meal, the first step is not doing, it's understanding. Prostate massage is not just a physical act, it's a mental, emotional, and physical process that requires care, patience, and proper tools. 1. Talk to a doctor first, especially if you're over 50. Before you do anything, have an honest conversation with your physician, especially if you're over 50. You've had urinary symptoms like frequent urination, weak stream, or pain. You've been diagnosed with prostatitis, BPH, or any rectal conditions. Why is this important? Because your prostate changes with age. Inflammation, enlargement, or early signs of cancer can alter how safe stimulation is and how your body might respond. A quick digital rectal exam or PSA test can rule out red flags before you go exploring. Dr. Alan Kramer, urologist. Many men don't even know they have enlarged prostates or chronic inflammation. Massage without clearance can make things worse. Get checked. It's not embarrassing, it's responsible. 2. Use the right tools, not just whatever's lying around. Do not use household objects, ever. Invest in a high-quality prostate massager or anal-safe toy made from non-porous, medical-grade materials like silicone, glass, or stainless steel. These are designed specifically for internal use, meaning Here's a breakdown of the most common red flag conditions and why they matter. 1. Active prostate infections, acute prostatitis. Prostate massage during an active infection is one of the biggest no-go zones. Acute bacterial prostatitis often involves high fever, chills, pain in the lower back, perineum or pelvis, painful urination or ejaculation. Massaging the prostate in this state can spread the infection further into the bloodstream, causing sepsis, intensify inflammation and pain, delay the healing process. Dr. Thomas Reynolds, urologist at UCLA, a man with active prostatitis who attempts massage risks making his condition exponentially worse. It's like trying to massage a swollen ankle. It only adds trauma. Always let antibiotics or anti-inflammatory treatment run its course before even considering internal stimulation. And get cleared by your doctor, even if you start to feel better. 2. Prostate cancer, diagnosed or suspected. Prostate cancer, especially in its early stages, may not show symptoms. But if you've been diagnosed, prostate massage should be avoided unless your oncologist says otherwise. Here's why. Massage may increase local blood flow, potentially encouraging cancer cells to spread. It can cause pain or bleeding in already fragile tissue. It may interfere with diagnostic procedures or therapy plans, e.g., PSA testing, biopsies, radiation therapy. Even in remission, men should speak with their care team before engaging in stimulation. Case study: James, 64, was undergoing radiation for prostate cancer when he tried massage after reading about its benefits. It triggered unexpected rectal bleeding and forced a treatment delay. His oncologist later clarified, "You should have asked first." Moral of the story: if you're in treatment, healing takes priority over exploration. 3. Severe rectal conditions, pain, hemorrhoids, bleeding. If you're dealing with internal or external hemorrhoids, anal fissures, rectal bleeding, anal inflammation or pain, then prostate massage is off limits, at least temporarily. Why? Because inserting any object, even a finger, into an already compromised rectal canal can worsen tears or inflammation, lead to infection, cause intense pain that overshadows any possible benefits. Think of it like driving a sports car on a damaged road. It doesn't matter how smooth the vehicle is. If the path is unstable, it's not going to be a good ride. Expert tip: many rectal issues can be resolved within weeks with proper care. Once fully healed, some men can resume stimulation. But healing comes first, says gastroenterologist Dr. Nina Kerr. 4th, post-surgery recovery, prostate or rectal. If you've recently had prostate surgery, like TURP or prostatectomy, Rectal surgery, e.g. hemorrhoidectomy, fissure repair, colon procedures. Then your body needs time to fully recover. Massage during this window can reopen internal wounds, trigger bleeding, interfere with tissue regeneration or sutures. Doctors generally recommend waiting 6 to 12 weeks post-surgery, depending on the procedure. And even after that, only with medical clearance. Patient story. Lucas, 39, tried prostate massage 6 weeks after a minor anal surgery. It felt okay at first, he said, but 2 hours later I had sharp pain and started bleeding again. His doctor confirmed that the scar tissue had torn open. Bottom line, listen to your body and your doctor. Even if you don't fall into one of the above categories, you should still proceed cautiously if you've experienced unexplained pelvic pain, bleeding after bowel movements, urinary incontinence, pelvic surgeries, e.g. hernia repair. When in doubt, always ask. No question is too awkward when it comes to protecting your health. Final verdict, should you try prostate massage? Here's the truth about the male G-spot. It's not just hype, it's biology. But is it right for you? That's the real question. So let's bring it all together. What actually happens when you stimulate the male G-spot, your prostate? Is it worth it? The answer is, it depends on your body, your goals, and your comfort level. But many men report extraordinary changes, both physical and emotional, once they start exploring. 1. Stronger, fuller, more intense orgasms. Prostate stimulation taps into a deeper neurological zone of pleasure. This isn't just anecdotal. Studies show that men who engage in prostate massage report longer-lasting orgasms, stronger muscle contractions, a warm, internal wave-like sensation that differs from penile ejaculation alone. Some even experience dry orgasms, non-ejaculatory, that are just as intense, or what's called a full-body orgasm that radiates from the pelvic floor. Real talk. The first time I had a prostate orgasm, I was speechless, said Marcus, 29. I didn't know that kind of pleasure existed. It wasn't just physical, it was emotional. I felt released. 2. Improved urinary function and prostate health. When performed regularly and safely, prostate massage can promote drainage of prostatic fluid, reduce swelling and discomfort in men with non-bacterial prostatitis, relieve pressure on the urethra, improving urinary stream and control. Dr. Elaine Thomas, pelvic health specialist. It's not a miracle cure, but for many men with chronic pelvic tension or inflammation, massage provides real symptom relief. It's like physical therapy for the inside. 3. Greater self-awareness and sexual confidence. Beyond the medical and physical benefits, prostate massage often opens up something deeper, a new relationship with your own body. You learn to slow down. You tune into subtle sensations. You let go of toxic shame around masculinity and vulnerability. It's not just about sex, it's about presence, trust, and exploration. Quote, "For the first time in my life, I felt connected to myself, not chasing orgasm, but being in the moment," said Tyler, 34. That changed how I show up in bed and in life. But is it for everyone? Number. And that's okay. Some men try it once and never return. Others build it into their weekly wellness routine. There is no one-size-fits-all. What matters most is how you approach it. With curiosity, not pressure. With education, not guesswork. With safety, not recklessness. And remember, if it doesn't feel right, don't force it. Your body will tell you what it needs and what it doesn't. Final verdict. Should you try prostate massage? So what happens to your body when you stimulate the male G-spot? You might experience stronger, longer orgasms. You might notice better urinary control or reduced prostate discomfort. You could discover a new dimension of your own sexuality and health. But this journey is personal. For some, it's life-changing. For others, it may not be the right fit. And that's okay. What's important is to approach the practice with curiosity, respect, and safety in mind. Final thoughts and viewer engagement. Sexual wellness isn't a luxury, it's part of being fully human. And today, we took one bold step forward in understanding it. We genuinely hope this deep dive into the world of prostate massage has opened your eyes, not just to the surprising layers of male anatomy, but also to the untapped potential that exists within every man's body. This topic, often swept under the rug or laughed off, actually holds real power, not just for pleasure, but for health, self-awareness, and even emotional healing. Too often, men's sexual health is reduced to function, erections, ejaculation, performance. But you've now seen that there's a whole spectrum beyond that, a dimension that includes relaxation, mindfulness, exploration, and yes, even vulnerability. And that's okay. In fact, it's necessary. Dr. Sarah Landon, sexual health therapist, puts it like this. When men explore their own bodies beyond what culture tells them is normal, they often discover not just more pleasure, but more presence. It becomes a healing act, a reclaiming. And isn't that what we all need? Less shame, more understanding, less stigma, and more conversations like this one. We know this may have been your first time hearing someone talk so openly and respectfully about the male G-spot, and that's exactly why we made this video. Because every time we lift the curtain, we help normalize something that shouldn't be taboo in the first place. If this video gave you something new to think about, a fresh perspective, or even just a few moments of curiosity, we'd love your support. Hit the like button to tell the algorithm that men's health matters. Share this video with a friend, partner, or even a health professional. It just might start a life-changing conversation. And subscribe to our channel for more science-based, stigma-free, real talk content about male health and intimacy. Got questions? Stories? Hesitations? We want to hear them. Drop a comment below. Whether you've tried prostate massage, are considering it, or just want to share your doubts, we welcome it all. Let's create a community where it's safe to talk about what matters. Your experience might help another man who's afraid to ask. Your insight might shift someone's perception. Your voice, yes, your voice could be the one that breaks the silence. Because at the end of the day, this is bigger than pleasure. It's about agency, body literacy, emotional courage, and together we can rewrite the story around what it means to be a healthy, informed, sexually aware man in today's world. Thank you for watching. Let's keep learning, questioning, and evolving together. Until next time, stay curious, stay safe, and stay open.